When you get sick or hurt, where do you go? Well, to the nearest emergency room, right? Well, even though you should seek immediate medical attention if you think you're in danger, there's a reason why the ER professionals at United Regional want you to know the difference between an urgent need and a non-urgent need for health care. 80,000. That's how many patients come walking or rolling into United Regional's emergency room annually, which equates to more than 200 patients a day. And for a level 2 trauma unit that serves several counties in Texoma, that's a pretty sizable number.
So we're a very busy emergency department for this area.
Director of ER Services Kim Stringfellow says so far, the summer months have been uncommonly busy for United Regional.
We normally have a very high census in the flu season, being January, February, and March, and then we typically have a drop-off in census in the summer months, seeing more of a trauma type patient, less of a medical type patient. And unfortunately, this season, we saw this last year as well, we did not have that seasonal fluctuation.
The reason being, more and more patients are seeking ER services for ailments that are not necessarily a medical emergency.
So the intention of the emergency department, or the whole foundation for its existence, is treating emergent medical conditions. And so some examples of that would be car accidents or high falls or burn patients, but we also treat medical emergencies like heart attacks or strokes, patients that are having difficulty breathing. However, we also recognize that we serve a bigger purpose than that in our community, and that's simply for medical access.
Which may explain why, if you come to the ER with symptoms of a head cold or a tummy ache, you'll see a longer wait time.
We have to make sure the sickest patients are treated first. Those emergencies get our first and foremost attention. Emergencies don't wait. So once those patients are stabilized and managed appropriately, then resources shift to the other patients that are here.
And the average cost of an ER visit for someone without health insurance isn't cheap. It can reach as high as $20,000, depending on the severity of the injury or illness and the mode of transportation used in getting to the hospital.
You do come to the emergency department as it is set up for emergencies. The cost of care is one of the highest cost of care locations for a patient to experience. So when you do have minor complaints, it is much more economical for you as a consumer to choose your doctor's office or urgent care or a clinic of sorts to get attention to that matter.
While there is a multitude of resources available for medical services in Texoma, Kim says care will always be available to those who need it at United Regional, whether you need help getting there on the ground or in the air, for urgent and non-urgent needs alike. And to make your trip to the ER faster and more efficient, Kim says, make sure you know your medical history before you get there, know what medications you take, and know what you're allergic to, and find a primary care physician. For more on this Healthy You story and others, go to Texomashomepage.com.